is Manu Kalia, physical therapist and Ayurvedic herbalist. So in this video, I'm going to go over Quadricep Tendonitis. This problem is called a tendonitis. Tendonitis is the incorrect term for it. It's not a tendonitis. In some of my other videos, I've spoken about patellar tendon issues, where also patellar tendonitis is the incorrect term. Just like that, the quadricep tendonitis is an incorrect term. The problem is quadricep tendinosis. So to kind of recap then, just to give you a better understanding of that and why it's an incorrect term, and then which affects our treatment. So let's go over that. And actually, before I go over this, just want to remind you again that our program on knee injury is going to be launching. You'll be one of the first to hear about it. Make sure you go to the site and sign up for the program, the first to find out about the program. Not only that, I'm going to be giving out some free copies. So if you're interested, and we're going to go over all treatment ideas for a lot of these common knee issues, not just treatment from the physical therapy, exercise science perspective, but also a lot of holistic treatments I'm going to include in that too. Herbal formulas, dietary things. It's a very comprehensive program that I've created. So make sure you get onto the site and check out and sign up for the program. If you have questions, shoot me an email. I can get you more information about the program too. Here's your quadricep tendon. This is the model of the knee, and the top bone is your femur, which is the thigh bone. The bottom one is your tibia, which is the shin. And the bone that sits on top of these guys here, this is your kneecap, your patella. So above the kneecap is your quadricep tendon. Your quadricep tendon is the extension of your quadricep muscle, which is your thigh muscles, which narrow out and turn into that quadricep tendon, which attaches to just above that kneecap. Okay, and so that's the area which is the problematic area for people who have this problem. Pain, thickening, weakness, swelling. So all these symptoms usually are along the upper part of that, just above that kneecap, along that quadricep tendon. Now, why is this not a tendonitis? Why is it a tendinosis? So, and there have been plenty of studies that have shown now that a lot of these problems, these are repetitive strain problems. Though yes, they can happen due to an injury or a forceful injury going through that tendon. You can have some micro tears or even a major tear for that matter, which eventually turns into a degenerative problem. But often they are a repetitive strain injury. So, repetitive running, jumping, any of those kind of things can cause excessive strain on that tendon, which basically the tendon can't keep up with the amount of load that's being placed on it. It starts to get irritation, starts to have possibly micro tears in it, and with that, pain, weakness, swelling, all these other things that happen. Now, it's not a tendonitis because histologically, it's shown there are not any inflammatory cells present in these problems, or very few inflammatory cells. Right? So it's not an inflammation that's going on. Anytime you have an itis, it means inflammation. So tendonitis, bursitis, conjunctivitis. Anytime there's an itis, there's inflammation has to be present. But there's not an inflammation going on, especially with these chronic problems. It's more osis, tendinosis, which is degeneration of that tendon, or degenerative changes that have taken place in that tendon due to repetitive load, right, or improper healing that's taken place. Whether because the person keeps pushing themselves and overdoing it, or nothing has been done to work on getting the healing taking place, or systemically, internally, there's something going on in terms of imbalances within the system that are slowing down the healing process and not letting that tissue heal. Right? Remember, normal injuries, you give it rest, you give it time, your body does the job. Right? It heals itself. But these problems, they become chronic often, and they can take quite a while to get better and heal. So As I said, the repetitive strain issues, but you can also have it, let's say, stop and go movements, acceleration, deceleration. If you jump and land awkwardly, you can also injure a lot of these tissues. At that injury, and as I said, there are no inflammatory cells present. It's more degenerative changes that start taking place in that tendon. The collagen alignment of the fibers. Remember, collagen makes up the tendon. So the alignment of collagen fibers is not in the proper orientation. It is in healthy, normal tissue. So normal alignment is parallel fibers of collagen, which give it its tensile strength as well as the ability to move properly. Right? In these problems, because of repetitive irritation, scarring down, adhesions that form, the tendon gets thickened. It's like a mishmash. So it's ropey, it's mishmash, and those fibers, they don't glide and move properly. Not only are they weak, they're thickened, and with pulling and when you put load on that, it hurts. So they also have poor blood supply often, which doesn't allow the healing process to take place, or circulation can be compromised. So the goal has to be, in that case, to break down those adhesions and scar tissue, allow for those fibers to lay down better, realign better, so they're in that normal, proper alignment, those collagen fibers. And once they're in better alignment, then working on strengthening exercise to strengthen the tendon. So breaking down the scar tissue and adhesions that have formed, improving the circulation to that tissue to facilitate the healing process, and then strengthening that tissue too. So keep in mind that it's not just strengthening the local tissue. You want to strengthen everything around it, because that affects what happens here. And not just here, systemically, inside too. So maybe the healing is not taking place because internally the person is not healthy, right? And it's compromising the ability of the system to heal, besides the mechanical issues or overload that's being placed on that tank. Okay? So keep a lot of those things in mind as you're thinking about the treatment part of it. So treatment, of course, hands-on manual techniques, scar tissue mobilization techniques, lacrosse ball or your fingers, and different techniques to break down adhesions and thickening that have formed through here. And heat, massage, all those things to improve circulation. Taking herbal supplements which can facilitate the healing process internally also. And then, of course, strengthening exercises afterwards. Improving mobility, strength, and overall health of the system to let that tissue heal better. So in order to treat this problem effectively, you have to take into account all those components. Okay? And also it gives you a better idea now, since that is not an inflammatory problem, it's a degenerative problem, and what you need to do in terms of addressing it. And that's why icing, anti-inflammatories, those things do not help these conditions. They do not help heal these problems. So much better to do other things which are like for mobility, for strength, for manual techniques, hands-on techniques, massage, scar tissue mobilization, as well as herbal formula, dietary things. All the things are much more effective in getting these things better. So as I mentioned, we're going to be launching the program, and it's going to be an awesome program which combines physical therapy, exercise science, and holistic medicine to treat some of the common knee injuries. And it's going to have exercises, it has massage techniques, it has acupressure, it has herbal formulas. It's a truly holistic program to address a lot of these problems. And if you want to be one of the first to hear about it, make sure you go to the site and sign up for it. If you're interested, you make sure you sign up, because I'm going to be giving out a few free copies. And if you found this information helpful, please share it and subscribe to the channel.